Hi, my name is Catherine Betancourt. This is the presentation on autism, and this is my part. What is autism? Autism spectrum disorder, ASD, is a neurodevelopment condition that affects communication, social interaction, and behavior. It is characterized by a range of symptoms and severity. The condition is called a spectrum because it varies widely among individuals in terms of challenges and abilities. How do children develop autism? Genetics, parental factors, brain development. Some examples of genetics are autism often runs in families and certain genetic mutations or syndromes. Example, fragile X chromosomes may increase the risk. Parental factors, such as conditions such as maternal infections, exposure to toxins during pregnancy, and complications at birth may contribute. Lastly, brain development examples are differences in brain structure and connectivity are noted in children with ASD, potentially affecting information processing. Prevalence. As of recent estimates, ASD affects approximately 1 in 36 children in the United States, according to the CDC. It is more common in boys than girls, with boys being about 4 times more likely to be diagnosed than girls. Rates of diagnosis have increased over the past decades, likely due to better awareness and diagnostic tools rather than an actual raise in prevalence.
I'm Rachel, and these are the characteristics for autism spectrum disorder. Autism spectrum disorder is a neurodevelopmental condition characterized by challenges in social communication, restricted interest, and repetitive behaviors. Social communication and interaction challenges are very common with children who have autism, showing difficulty responding to their names, initiating or sustaining conversations, or engaging in joint attention behaviors such as pointing to shared interests. They may also struggle with nonverbal communication, such as using eye contact, gestures, and facial expressions efficiently. So, some of the repetitive behaviors and restricted interests that autism spectrum disorder may display are movements such as hand flapping, spinning, or rocking, as well as intense focus on a specific object or topics that are unusual in intensity or focus of their age. And also with autism spectrum disorder, language development in children can be delayed, they have limited vocabulary, or engage in echolalia, where they repeat words or phrases. So for the inclusionary practices, there can be many different ways that can help people with autism spectrum disorder. So adapting the environment or materials to support sensory and communication needs. For example, providing visual schedules. That means having a printed out schedule on their desk of the activities that will be done for the day, or having something on the wall for them to go up and remove stuff that they have completed so they know what track they are on. Structured routines, and minimizing sensory overload through noise canceling headphones or dimming the lights can help children with autism spectrum disorder and navigate the classroom environment more effectively. Some modifications typically involve adjusting the curriculum to meet the individual's learning needs, and teachers may simplify tasks by reducing the numbers of items on a worksheet or extend the time that's allowed for activities to accommodate different processing speeds and abilities. So, children with autism spectrum disorder are required a combination of individualized support and collaborative efforts among educators, families, and specialists. And these type of strategies can help ensure the children with this disorder to thrive in an inclusive learning environment. Now for legal obligations. So there is the Americans with Disability Act, which stands for ADA, and this federal law prohibits discrimination against people with disabilities in all areas of public life, including education. So, with ADA, schools must provide reasonable accommodations such as a quiet room for exams and extra time for assignments. The next one is IDEA, which stands for Individuals with Disabilities Education Act. And this law ensures that students with disabilities have access to a free and appropriate public education. And lastly, children with autism may qualify for an IEP if they need specialized instruction, such as working with a speech, occupation, or other therapist. And now I'm going to pass it over to Adam so he can discuss.
Next, we're going to talk about environmental accommodations for autism. First is routines, making sure to establish clear, ordered routines and providing warning and preparation when changes are anticipated. Visual aids, using colorful visual aids and delivering instruction visually. Social skills, teaching social skills and planning and practicing communication strategies and social routines. Sensory-friendly environments, creating sensory-friendly environments and providing earplugs or noise-canceling headsets. Flexible scheduling, offering flexible schedules. Alternative exams, providing alternative exams. Counseling, providing counseling such as cognitive behavioral therapy or social skills training. Instructional strategies, create a structured environment pre-K and K through 3. Establish predictable day-to-day routines to help students feel more in control and know what to be expected. This can reduce impulsive behavior by allowing the student to expect what comes next. Use of visuals, pre-K and K through 3. Incorporate visuals such as pictures, videos, tablet screens, and visual schedules to support lesson objectives and help students understand without relying solely on verbal communication. Promote social activities and skills, K through 3. Teach students how to increase social cognition and emotional regulation to help them with social interactions and peer relationships. Incorporate technology, K through 3. The use of assistive technology such as text-to-speech software, tablets, or specialized keyboards to help students communicate. Also, integrate and incorporate student special interests into lesson plans, curriculum, and activities to help them learn academic and social skills. Create a sensory-friendly environment, birth to 2. Use soft lighting, calming music, and tactile surfaces to help students regulate their sensory response and not get overwhelmed by brightness or loud noises. Use simple, clear language, pre-K and K through 3. Use concrete materials and language and provide pictures showing how to complete a task so there's no confusion. Support transitions, pre-K and K through 3. Prepare students for transitions in the daily routine. Next, we're going to talk about family involvement. Ways that family members can be involved includes communication with the school, regularly contacting teachers, attending parent-teacher conferences, providing teachers with details about their children's preferred learning styles, triggers, impulsive behaviors, communication methods, or sensory sensitivities. Actively participate in their child's individualized education program, also known as an IEP, meetings to discuss goals and available support strategies. Advocating for necessary accommodation and supports for their child, such as assistive technology, extra time on tests in order to ensure the child's needs are met. Practicing therapy techniques taught at school, at home to promote consistency.
Hello, this is Charmaine Bouquet, and this is my part in the autism group presentation. Family involvement. Autism resources in Miami-Dade County. University of Miami Center for Autism and Related Disabilities is a state-funded organization that provides free services for people with autism spectrum disorder and related disabilities. Early Step Center. Early Step Center offers early intervention services for families with infants and toddlers birth to 36 months who have developmental delays, autism, or other disabilities. Autism Speaks. Autism Speaks promotes understanding, acceptance, advocacy, support, research, and screening of children with autism and related conditions. Miami Autism Recovery Preschool. Miami Autism Recovery Preschool prepares young children with autism for a smooth introduction to school through therapies, developing social interaction through play, and customizing meals adapted to each child's dietary needs. Sample activity for children with autism, birth through age 4. The activity is called Sensory Exploration Bottles. The objective is encourage sensory exploration and calming engagement. The materials needed for this activity is clear plastic bottles with secure lids. Fill each bottle with different materials. For example, water with glitter, beads and oil, colored water with small objects. The activity, the children can shake, roll, or observe the bottles during playtime or as a calming activity. Also encourage the use of descriptive language by labeling what they see. For example, blue water or sparkling glitter. The next activity is for children with autism for pre-K SPED. The activity is called Visual Schedule Matching Day. The objective is to support routine understanding and social interaction. The materials needed for this activity is laminated cards depicting daily activities like snack time, circle time, playtime, a visual schedule board with Velcro strips. And for the activity, present the child with activity cards and have them match the card to the corresponding spot on the schedule. Once the child completes the match, discuss the activity and encourage participation. And for the last sample activity, for children with autism, for kindergarten through 3rd grade, the activity is called Emotion Charades. The objective is to build emotional recognition and social interaction skills. The materials needed for this activity is cards with drawings or photographs of different emotions. For example, happy, sad, angry, or surprised. For the activity, each child takes turns picking an emotion card and acting it out while others guess the emotion. Provide prompts or guidance as needed. So for example, you will help the children say, show us a happy face. The last slide is our handout. The handout is basically summarizing things about autism, which could be given to teachers, parents, or caregivers. And this completes our presentation for autism. Thank you.